Hi, everyone. So welcome to November office hours, BHA Technology office hours. If this is your first time here, welcome. We're so excited to have you. A little bit of a preview. So what is BHA Technology office hours? They're a meeting hosted by the BHA team for behavioral health providers, specifically for data and admin teams. And at these meetings on a monthly basis, we provide updates on changes and improvements to BHA technology. We surface and discuss technology-related questions. We provide feedback and engagement opportunities on all of the projects that we have going on as a team. And if you're curious about what we've talked about at past office hours, Amanda Tyler, who is my helper today, will put in the page for the providers page on the BHA website, which includes all of the 2023 recordings and slide decks in case you want to take a look at those. So some housekeeping, every office hour at the end, we have an open Q&A time. So if you want to put in any topics that you would like to discuss, you can put them in the chat and we'll bring them up later. We also have a survey where we collect monthly hot topics. So Amanda will put that in chat in case you want to fill out the survey for next month. Also, if you ever have any technology related questions, we have our support email on the screen, and we're also piloting a new messaging system for technology related updates. So if you are interested, please sign up via that form that Amanda will also put in chat. And as a reminder, we do have a Google group for office hours, but we will be sunsetting that in favor of MailChimp in 2023. So make sure to sign up for that form, especially if you are not in the Google group, as we will be exporting the Google group emails in 2024. So now to the guts of today. We will be talking about training schedule for the remainder of 2023. We have some updates from the BHC&E team, and then a couple of quick updates on our projects that we've been talking about all year, CCAR DACOD's modernization, as well as the referrals platform. And then we'll leave about a half an hour at the end of our time today for open discussion and Q&A. So jumping in, I'm going to hand it over to our training team to talk about the remaining training schedule dates for 2023. So I don't know if Sharon or Troy, you want to speak to this, or I can jump in as well. All right, I'll jump in.
Abigail, real quick, I just wanted to let everyone know Jackie is out ill today and was unable to do the training that was scheduled for today. So if you were scheduled for training today, please, the November 28th and December 27th are the next scheduled trainings. We apologize for any inconveniences.
Yeah, thanks, Troy. And in 2024, we'll provide some additional detail on training and how you'll be able to get involved with that as well. So more details there to come. All right, with that, I'm going to hand it over to Dan, who's going to talk us through some updates on the Behavioral Health Claims and Eligibility Project.
Good afternoon, everyone. First, kind of as a general reminder, the BHC&E project impacts community mental health centers, ASOs, MSOs, and the provider networks put together by the ASOs and MSOs. So if you are not one of those organizations, BHC&E doesn't apply to you at this particular point in time. The project originated out of the Colorado Behavioral Health Task Force, Blueprint for Reform, with the mission to create a single financial management system. So that involved changes to CBMS, the Colorado Interchange, also known as the MMIS system, and the BIDM. The BIDM is just a state use system for data analysis. So there are changes to that relative to the project, but don't impact any of the providers. I don't have any major announcements across the project right now. I did want to touch on the Peak Pro training that's been going on. I really appreciate everybody's response to that. We've had probably 8 to 10 organizations participating in the training so far, and one round is going on even as we speak. Probably a total of about 60 to 70 people have gone through that training. By middle of next year, we hope that the training will actually be available online, self-paced, so that organizations can, get people in through the training and get accounts very quickly, rather than having to wait for HICPUF personnel to be available to give the training. What I do have to cover are some questions that came in after the last tech office hours. So thought I'd just go through those questions and may provoke some other questions, additional discussions. So be sure to pipe up if you've got those questions, or send them again as follow-up, whatever works for you. So next slide. So this question was provided, asking for understanding of expectations around intended use and workflow of Peak and Peak Pro, specifically around the registration and obtaining a state ID. So just as kind of a point of clarification in the vernacular we will try to use consistently, Peak is the web portal for individual people to go up and apply for a state benefit, anything that's managed within CBMS. So that includes now BHA, it includes medical assistance, CHIP Plus, SNAP, cash. I think there's a child care benefit in there too. So that's the Peak avenue into that. Peak Pro is an enhanced web access for BHA providers, and it can be used for checking eligibility or creating an application for a benefit. Previously, Peak Pro had been used mainly by SNAP counselors, so it's been expanded in its functionality to support BHA providers. Occasionally, the screenshots still say Peak because there's a common back-end piece to it, but Peak Pro is what we'll refer to for provider use, and it does have that enhanced functionality over what an individual in Colorado would be able to see in creating their own Peak account. CBMS is being used for the eligibility determination on means-tested programs. If you have those in your contract, there are multiple programs with a 300% FPL limit for participation. Please stay on question 1. So that's what Peak is there for, to submit that application. CBMS does the processing in the back end to determine whether somebody meets that FPL requirement. The application is exactly the same as what's used for medical assistance, and both Peak and Peak Pro will prompt whoever's in front of the screen to select both programs to maximize the benefits that the person might be available for. So it's basically the same application. No additional information is required to submit a Medicaid application as a BHA application. Where exactly Peak Pro resides within an organization for your internal workflow is up to that organization. It might be in intake, it might be in billing, it might be in case management, it might be somewhere else. But that aspect of the workflow is what's determined by you and your own particular organization. I will say that there is some confusion occasionally on the state ID. Different benefit programs that are in CBMS use different terminology for that member ID. Might be member ID, state ID, client ID, Medicaid ID. We're trying to coalesce on one particular term. In this presentation, I say state ID. Sometimes it's referred to as Medicaid ID, but that state ID is created by CBMS. It's an ID number. It doesn't imply state driver's license or a state issued, identification card. It's just that number that's created for that individual to be able to track them through any of the programs that are managed by CBMS. Okay, next slide. A question came up on management and maintenance of user accounts, and I think there has been a couple of different answers provided at different times, some during the training, But this is the particular answer, the accurate answer. Management and maintenance of user accounts is really at two different levels. We need that single point of contact from every organization that has to request that organizational access. There's a data use agreement that has to be agreed to, signed electronically as part of that. So that's one level. And then individual users have to fill out a third-party user access request form, and that has to be signed by that single point of contact for the agency, for the provider, before it goes into HCPF. And once that's sent in, then HCPF goes through, make sure all the information is correct, and then sets up that individual user account. It does take some time to get that individual user account set up. So for training going forward, we're going to ask that people fill out that third-party user access request right away, and we'll just hold it until the person completes the first 2 training sessions. But we'd really like to get those third-party user request forms in as soon as possible. There is no requirement within a provider IT staff to do anything unless that person happens to be your single point of contact for the organization. There is technical support available for individual Peak Pro accounts at the phone number given here. It can be found on HCPF's website as well, and we'll start doing some provider website updates of our own to link to those kind of things so they're available in multiple places. Next question. Kind of related to the previous question, question on account reactivation and recovery came up. There is no self-service if you're in that reactivation and recovery scenario, unless it's a password recovery. But a user has to use the account at least once during any running 60-day period, or the account will be deactivated. This is purely from a security perspective. If somebody leaves an organization and the single point of contact for the organization doesn't inform HCPF that the person has left, this is just an automatic way to try to sweep those up and not have unused accounts laying out there. The person will receive 3 separate emails before accounts deactivated, and it will include what they need to do to maintain the account active, who their organizational single point of failure is, or single point of contact is. So they will have all the information they need in those 3 emails to make sure their account stays active. If it does get locked due to inactivity, it is the organizational contact that has to get in touch with HCPF to have the account reactivated. And again, it's purely a security perspective, seeing as how a Peak Pro account gives access to information on benefits programs that a person might be eligible for. But it has to go through security, not through the normal tech support line. Next slide. Question was about handling clients who didn't qualify for, refused to, or are unable to sign up for a Peak account. So I was a little confused by the question, because I don't think anybody would not qualify for a Peak account because that's for an individual, within the state of Colorado. There may be challenges for somebody to create a Peak account if they're homeless, don't have access to a computer or internet. So undoubtedly, there will be challenges in some programs to create that state ID for the individual. And that's one reason why all the providers will get a Peak Pro account, so that an application can be submitted, a state ID can be generated for that individual. I kind of speculated that maybe this question came into play in crisis programs where somebody, may not be able to even answer questions depending on what's going on. And crisis programs are also available to people from, outside of Colorado who happen to be in Colorado and may find themselves in a situation where they require some crisis care. They may choose not to identify themselves, knowing that, they're leaving the state or something. So there are cases there where there would be no Peak account, and there is a generic ID that can be used, and we'll get into that in the next question in a little more detail. If a person does go through a crisis care situation and then moves into some other follow-on program, then clearly the person has to be identified, has to have the state ID, for eligibility determination in that program. Ideally, somebody can be on Medicaid, get federal money instead of state money, and state money goes further. So next slide. A couple of different questions in this one. The encounter submissions for capacity-based programs and a state ID required and the generic ID all kind of came into this question. The encounter submissions for capacity-based programs is really what the BHA does today if your program requires encounter submissions. We don't pay based on individual encounters or claims. So, this is no difference in terms of capacity-based programs. The state ID is required on encounters submitted into the interchange. The interchange is created in CBMS, which feeds that information into the interchange so that an encounter can be validated as far as the person receiving service, make sure they're not eligible for Medicaid and it shouldn't have been billed to Medicaid instead of BHA. So that's just, the practice that we're going to have to go through once everybody gets brought onto the program. There are generic IDs that are being created for use in the crisis environment. And again, that's where somebody comes in, can't identify themselves, doesn't want to identify themselves. We're creating free, unique IDs, male, female, and unknown, and it's limited to those three categories because that's what's available within the MMIS system. They are statewide, they are not unique to a provider, but because we know who submits an encounter and the encounter has to include information on the billing provider, we know who, is using that generic ID. So that's something that will be just checked to make sure the usage makes sense across all the programs. Next question. Again, kind of related to submitting updated encounters if the state ID is later known from the generic ID. I think we need to get into a little bit of use of the system. Currently, we're saying that if a generic ID is used in a crisis program, then updating that particular encounter submission is not required. Certainly, like I said earlier, if the person goes into an additional care environment and the person does have to be known for that, then a real ID has to be generated for that person if they don't have one. The question, extending it to incorrect state ID, I viewed that as kind of a different question than the generic ID, so I hope I'm interpreting the question correctly. Clearly, if an incorrect ID is used and it's found out that an incorrect ID was used, it would be incumbent to update that encounter with the correct ID. You can't just make up an ID number because it's validated in the interchange. So an invalid number would not go through. I believe this processing to check against the name, date of birth, things like that to validate that this is the person it's supposed to be. I see a question in the chat about who's creating the generic ID. It's being created by HCPA. That generic ID is unique in the interchange, or those three IDs are unique in the interchange. CBMS doesn't even know about it. So once we're putting people into the system on the crisis side, we will tell you what those unique IDs are. Okay, next question. Question was on the design of the platform, requirements for API integration, single sign-on. The systems are really built to be pretty much standalone. There's no API integration. Peak Pro is through a web access. Similar information is available once you sign up as a provider in the interchange. If you don't have that already, if you're not if you're a Medicaid provider, you have that interchange provider portal. So there's multiple places to double check somebody's eligibility, and then Peak Pro for submitting a new application and creating an ID. Interchange encounters is submitted through file drop to a Move It folder with a user ID and password for whomever in your organization does that. If you have I don't want to say it that way, your EHR or billing system could possibly have additional X12 interface capability. So you might be able to do EDI transactions like the 270, 271 for healthcare eligibility benefit inquiry and response. Those are just built into the interchange. So if your systems have that ability to do a 270 EDI query, then that's available to you as well. I wouldn't call that an API integration. It's just a function of the X12 specification. So that's all I have. I don't see any other questions in chat. So again, I'll be on the rest of the call, but if you've got other questions that pop up later, don't hesitate to send them to Abigail, to me, through the anonymous question form. Sorry, Abigail, I don't know how to describe it, but there's multiple ways to submit questions into us, and we'll get back to you. I will say on these 7 questions, I do have a document that goes into maybe a little more verbose of answers, and we'll get that out to the crowd here shortly. Thanks, Abigail.
Yeah, thanks, Dan. No, you nailed it. So yeah, I'm going to quickly go through these final 2 updates, and then if folks have questions on behavioral health claims or eligibility, we can talk about that more in our QA, and definitely put any questions you have on this or any topic in chat. But quickly, just so we can get to that Q&A time, a couple of updates on the modernizing CCAR and DACOD's work. First of all, I want to thank everybody on this call who provided feedback to us prior to the October 27th deadline. We received over 50 responses, and those responses were incredibly thoughtful and detailed, and we just really appreciate them, and they're really going to help us make this this modernization project even better. So we really thank you. We're taking the next week or so to in-depth respond to each of those pieces of feedback. And we're thinking it's looking like the week of Thanksgiving, earlier in that week or prior to the holiday, we'll be able to post those responses and give some more detail on what the next engagement opportunity around this project will be. So we know that we will be offering 3 more share out and discussion sessions where we will present out on the feedback that we received and our responses. And then at that time, we'll also be able to provide more detail on how folks can engage in the 2 tracks that we've previously talked about, which are data model stakeholdering as well as tech selection stakeholdering, technology vendor selection. So if you haven't, I or Amanda will put that sign up update form in the chat. So please sign up for that if you want to get email updates from me on this initiative, and make sure to check CCAR DACOD's modernization. So that's the update there. You'll be hearing us some next steps in the next week or so. And then a couple of updates on the referrals platform. So again, this is the high level timeline that I like to use to show how we're tracking on this project towards our January 2024 launch. So we are currently in November, and next week we'll be conducting our final group of user testing pre-launch, although we will definitely still continue to do user testing in platform improvements post-launch. So this will not be the last time that anybody will be able to contribute or provide feedback. We'll also be releasing a more detailed timeline a little later this month so that providers have ample time to prepare for that January launch. And so, like I said, we're conducting our 3rd group of test users this next week. If you're not a part of that group already and want to be, please email me and I can include you on those sessions. The next step for this, and I'll talk about this at our next office hours and also send out email updates, but we're going to be holding information sessions throughout December to prepare providers for that January 2024 launch. And I will have more details on that in the coming weeks. And again, the call to action here for the time being is please sign up via that form, check bed capacity and referrals platform, and you'll be kept informed of those opportunities along the way. So now we want to turn it over to you and see what questions you have for us. One of the things that I thought we could talk about today, in addition to whatever items folks want to bring up, is that next month is our last office hours of 2024. So maybe a question that people can speak to or put in chat is like, what would you like us to talk about as sort of a year-end wrap up for office hours? Are people interested in sort of like a preview of 2024? Do they want to hear a recap of what our team did in 2023? Or is there anything else that you'd like to talk about as sort of like a wrap up office hours for 2023? So I'll start us off with that prompt, but any questions that providers have, please come off mute or come and type in chat and we can address those questions. A preview would be great. Okay, that's awesome. I love that. Mona, I see your hand.
Hey, Abigail. I've been chatting with Region 4 and putting some information out about Peak Pro, and one of my hospitals reached back out to me and asked whether or not they should be signed up for Peak Pro. But it sounds like, based on what Dan was saying earlier, probably not. I just want to verify.
Yeah, I saw that question come in on an email, and there was a lot to unpack there. But yes, unless you are CMHC, ASO, MSO, or a provider network under an ASO or MSO, you don't have to get Peak Pro.
Okay, thank
Matter
you.
of fact, matter of fact, there may be limits on our ability to give it to you purely because of privacy, HIPAA requirements, 42 CFR Part 2, et cetera. So there are people who have requested Peak Pro training, but a couple, not to put them on the spot here or anything, but we've had to deny them because, again, we just can't share, certain proprietary information with everybody. So if they don't fall in that category, they don't have to worry about it.
Thank you.
And Dan, there's another question in the chat from Wendy, and I'll read it aloud for the recording. If an EHR is currently submitting 270, 271 to HCPF, will that process change? And will the increased funding info come over as well?
I was starting to write a response to that one when the other question came in. So yeah, any existing interface you have with HCPF, with the interchange, anything related to Medicaid doesn't change whatsoever with this project. If you submit a standard 270, 271 and have somebody's state ID number, it should return a full set of benefits, whether it's Medicaid or BHA. The increased funding info, again, the BHA contracts with providers. So just by submitting a 270, 271 does not open up a different billing avenue. You have to be a BHA contracted provider to bill a service to the BHA. And you don't even bill based on an encounter or a claim. It's all, defined within your contract.
Thanks, Dan. Elizabeth, go for it.
Hi, Dan. It's Elizabeth with Carolyn Behavioral Health. I was about 10-15 minutes late for our meeting this morning, so you may have already discussed this. But I was wondering if you had an update about whether Signal is done with their pilot, if any of the documents, guides, everything is ready so that ASOs could start going through the process.
I did not provide an update on that. I had it in my head to do that. Signal has successfully submitted encounters into the production interchange, and they've flowed through into the BIDM to support some of the BIDM development work that HCPF is doing. We're working on the provider guide, should have some internal review done in a week, and then provide it to the larger group. We do have another MSO that is in the pipeline and they had some internal challenges, or they would have started submitting some test encounters last week without this additional documentation. It's the CMHC, so they've done encounters before, or 837 claim transactions anyway. The difference between an encounter and a claim is minimal. So we hope to hear from them next week on submitting some encounters. But if you wanted to start, because of your expertise in 837s and Medicaid work, and ASO could start any time, we're not pushing it from a schedule perspective at this point to get the next person in. So if you want to wait for the companion guide, that's perfectly fine.
Yeah, thank you so much. Yeah, I didn't want us to push forward on doing it if we didn't have any guides or logic stuff that we could put together that our IT folks could actually, like a meet they could do for the work. So thank you for clarifying. Appreciate it.
Mm-hmm.
Great questions. I'm just going to elevate a couple of things from the chat on the topic of like what you folks would want to see in like a 2023 retrospective. People are saying a preview would be great, a roadmap, outcomes for 2023, and an anticipated roadmap for 2024. Those suggestions are really awesome, and we will work on those for sure. Other questions about any initiatives or any thoughts on content or things you would like the BHA technology team to answer in a 2023 wrap up and a 2024 preview? Okay. Quiet group. So we'll do what we always do, which is the BHA folks will stay on the call, and people can casually ask questions or just hang out with us and chat. But we'll stay on until 1:30. But the sort of active presentation part of the call is done. So if folks want to log off, they can, and you can always watch the recording to see if there are any questions answered and after you logged off. So we'll be here, but if you need the time, definitely take it. Otherwise, we'll be here to answer any and all questions.
Thank you.
Yeah. Thanks, Elizabeth. Oh, I see one. And we have one Q&A. So someone said, maybe provide a proposed workflow of a client coming to an agency and then agency using Peak Pro. So I think the ask there is maybe like a more human-centered flow of what that might look like. And I think that's, Dan, maybe something you and I can talk about.
Yeah, I think there's already some thought around that area. Do a little bit of UX review of what Peak Pro looks like. So I think that's already being contemplated, and Justin on our team has put some things in motion already. I don't know when we might have that available, but that's a really good ask.
Yeah, thank you for that Q&A, and we'll definitely make sure to provide an update on when that type of view might be available, whether it's next month at this meeting or in a different venue.
Tabitha, I had significant problems trying to get into the meeting today. Every time I would click on the link that I had already registered for, it asked me to register again. So I registered about 10 times before it let me in. Has anybody else complained of those problems, or maybe it's just my computer?
I haven't heard anything to that effect. And I actually just registered again today, just as like a trial. So unfortunately, maybe something to do with like what accounts you're signed into in your browser potentially.
Okay, that is kind of what I was thinking it was, but I wanted to double check with you.
Yeah, and I'll let you know, Elizabeth. Like, email me if you're still having trouble, and I'll let you know if I hear of anything else. But I haven't so far.
Perfect.
I
Yeah,
did
it's
have that happen.
interesting. Oh, you
Sorry,
did?
Elizabeth, I did have that happen to me once before on a different BHA meeting series, but not this one. I don't know
Okay.
what causes it.
Yeah, it's interesting because my autopilot, which takes the transcription notes for me, that joined with no problem whatsoever. It was I don't know, it was me in my own invite, but it doesn't matter. We'll figure it out. Thank you.
All right, thanks, Elizabeth, and let me know if I can be of any help.
Yeah, thanks. I'm just going to hang out in case there are any questions that come in.
Sounds good. And yeah, everybody else who's still on, so we accomplished sort of the content section of office hours today. So now for the last kind of 20 minutes, we're doing Q&A on anything that might be on your mind, or any questions you might have. But if you want the time back, you can definitely log off and review any questions that folks ask after the fact. Up to you. We will be here. All right, well, I think we've given folks a couple of minutes, so I'm going to go ahead and end the recording. Thank you so much, and we'll see you at December's office hours. All right, bye everyone.
Bye.